What I thought I'd do today is to start off with kind of talking a bit about Atlantic Philanthropies and how we became interested in impact assessment, and then move into some of the lessons that we learned as we tried to ingrain an evaluation approach into our work, and then kind of finish up with where I think we're at kind of at this moment in terms of impact assessment within the field in the Republic of Ireland. So in terms of evaluation and Atlantic, we're often kind of credited with or blamed for bringing impact assessment into various fields within the Republic of Ireland. I think it's interesting to go back to about 1996 when we first started to get interested in evaluation. I think it's fair to say that we didn't really know what we were doing at the outset. We were kind of buying into a movement that was international, that funders should be doing this. And I remember my namesake, John Healy, saying to me when he hired me, I don't really know why I hired you, but I think we should be doing something in this space around impact assessment. So we felt it was the right thing to do, but it was somewhat of an afterthought. In around 2002, we started to adopt a far more strategic approach to our work and really pulled the place apart. We had a new CEO, and he came in and essentially really revamped the place and brought in a new strategy and brought in a new way of working within the organization. The reasons why we started then to get into evaluation in a more serious, thoughtful way were threefold. The first was, and Andreas referenced this, was because of the organizations we were funding. We wanted the evaluation approaches to be of use to them. So if we were funding, for example, the Treatment Action Campaign in South Africa around the issue of antiretrovirals, we wanted them to be learning about how well their campaigning was influencing the various audiences that they wanted to influence. The second reason was for our own internal strategy, so that in terms of allocating resources within Atlantic, we could do that in the most efficient way possible by understanding the kind of progress that we were making. And then lastly, as a spend down foundation, we wanted to leave behind a legacy of lessons within the work. Now, I think what's important is that the lessons that I would generically take out of that experience from moving from an organization that was, I suppose, somewhat confused as to why it was getting into evaluation to an organization that really ingrained it into everything we did was that the first was really that it needs to fit in with the culture and the strategy of the place. So in the first instance, when we started off, tinkering around with evaluation, we really didn't, I think, understand the full import. By the time we came to 2002, we really were focused in on a strategic approach, and evaluation and impact assessment became ingrained into everything we did. So it was no longer kind of a small group of people who were passionate about evaluation trying to convince a larger skeptical audience. It became ingrained into what the approach that the frontline staff had to the work that they did. I think it also helped to have penetrating clarity around why we were doing this. So it wasn't, again, just something a process that we were going through because we felt that it was, somehow a good thing to do. It was because we wanted to impact on various audiences, primarily the grantees in the first instances and the movements that we were funding. So we wanted those movements to have both learning systems built in to the work that they were doing, and secondly, we wanted them to have credible evidence of the work so that they could convince others of the merits of their approach. I think that was something also that internally, when it came to making the case for budgets for evaluation, so Andreas referenced the need for people or funders to actually fund impact assessment. I think having that kind of clarity and having had it discussed internally as to why we were putting sizable resources into evaluation made it much easier to advance the case. And also having the support of leadership was essential. So in terms of, for those organizations that are struggling with how they build more of an evaluation approach into influencing either the systems where they work or their own organizations, I think having an understanding that you really need to ingrain this work into the actual culture of the place and that it becomes part of, the staff's identities about what their roles are. So within Atlantic, we began to see ourselves not just as people putting money out into the field to good grantees, but as funders of overall efforts to shift the needle in terms of some social campaigns for which evidence was a crucial component. So whether it was funding immigration reform in the US or death penalty campaigns, or whether it was public health reform in Vietnam, or indeed in the Republic of Ireland in the children's space or palliative care. Evidence was ingrained into that work and really became as part of the oxygen of the work that we did. Also, the support of leadership, I think, is crucial. And again, it can be very difficult to use evidence within systems where leadership is ambivalent, or where there's sort of a lack of passion around how evidence can really advance your cause or your mission. In terms of our approach, just very briefly, we're quite eclectic. I mean, one of the caveats that I always have when I'm asked to talk about impact assessment is, I think the worst thing you can do is lead off with a tool or come in with a sort of a shiny presentation which in 3 or 6 or 7 easy steps brings you to the impact assessment nirvana. I think the best thing that funders can do is start off with some curiosity about what their grantees know already. And I genuinely mean curiosity, to sit with them and to ask them questions about what it is that they plan to achieve and how will they know if they're on course to achieve it. The approaches that you take then can vary from randomized controlled trial assessments, which can be very costly and time consuming, or to a more kind of pragmatic learning systems which are ingrained into campaigns, which provide ongoing kind of feedback for activists in terms of whether or not they're convincing the various audiences that they want to convince. So I suppose the kind of advice that I'd give to funders would be, start off with questions, sit with your grantees, ask them about their plans, ask them about the current approach that they have to learning, and then build the evaluation approach or the impact assessment approach in around that. Within Atlantic, we purposely didn't have a performance measurement system for some of the reasons that the Minister referenced. We didn't want to have this kind of feed the beast approach to evaluation. I wanted to keep it needs driven. We looked at having a system where we could hoover up all the evidence and come up with a fancy dashboard, and walked away from it because we felt it would be too onerous on the grantees and would take away from the more needs-driven approach. In terms of the benefits have been primarily at those 3 levels. So the grantees, say for example, if you take the children's space in the Republic of Ireland, again, being able to provide a suite of lessons across how to intervene in early education and with children, I think in the early life stages with children, has been hugely important for us in terms of our work in the Republic of Ireland. Similarly with palliative care, really ingraining evidence into that work, I think, has improved the work that the grantees do. And again, this is work which has been led by the grantees, not necessarily by us. In terms of the legacy also as a spend down foundation, I think leaving behind this body of material in terms of how you can, whether it be something as technical as intervening in terms of parenting skills and all of that, or whether it's something more pragmatic such as advocacy, campaigning. There's a wealth of material which we're dedicated to sharing about the work that our grantees have done and about how they've brought about social change, which after we're gone and after the money is spent, is one of the key things that we will leave behind. In terms of where we're at the current moment in terms of impact assessment, I think that there's kind of a negative scenario and a positive scenario in terms of how we'll end up in terms of the type of systems that we'll adopt. So the negative scenario would be that that we'd end up with this sort of Kafkaesque nightmare of performance measurement systems where everybody is inputting into data systems which are of little benefit to the NGOs themselves, where different funders have different assessment approaches. One of our grantees in the United States complained that they had 50 different reports to produce for their 50 different funders. And that's a very real possibility. There are systems which, some of us, myself included, when in a previous life, had to fill out for EU funding, which again were very Kafkaesque. So having, I think, a more needs-driven approach to impact assessment is crucial, and working with the fields so that the fields that we fund as funders can actually get a benefit out of the impact assessment approaches that we use, I think is crucial. Also in terms of public sector reform, we're at a point in time now where public sector reform has come on the agenda in a way which it hasn't for many years. Now again, there's a positive scenario and a negative one. One is that, as resources get tighter and we have to get less from more, that it becomes the impact assessment becomes an expensive comfort blanket for taking hard choices which are really in the interests of vested interests. I'm actually more optimistic. I think that this is a point in time where questions are opening up, and evidence can play a role in terms of answering where resources should get targeted in a way which hasn't happened hitherto. So I think that this is a time where, for those of us who are interested in this space and who are interested in terms of advancing an agenda and improving the way in which public services and practice within the non-profit sector delivers services, care, and advocates on behalf of the groups that we care about, that this is a golden opportunity actually for us in terms of rolling up our sleeves and engaging with the agenda in terms of the types of impact assessment processes which we'd like to see in the sector. Thank you.